3. You must receive training. You must receive training and pass a test to prove that you are competent to work in this field. The demand for healthcare workers continues to grow, given that the population continues to age. But, it is more likely that you will travel around town each day, caring for 2, 3 or more people on any given day. Meanwhile, home care aides work for various private and public agencies. You do not need a high school diploma to get a job. Never got your high school diploma. Five. Dot. Training does not exceed 75 hours in most cases. Home health care workers are people in charge of caring for the sick, disabled and elderly in their communities, and there will always be people who are mentally or physically unable to care for themselves. The other, most obvious, benefit is the ability to really make a difference in someone's life in a way that you cannot do with many other types of jobs. Working as a home health aide or home care aide does not require that you have one. 4. While they do receive supervision from time to time, most of the work they perform on a day-to-day basis is done on their own. Understand the benefits. People who appreciate flexible, non-standard work hours will often choose this type of position. In fact, you may care for the same person for months or years. Armed with the right knowledge, you can make the right decision about whether this is the career for you. The work is usually performed within the homes or residential facilities of the people receiving care. However, in general terms, the two primary types of jobs you can get are that of home health aide and home, or personal, care aide. For example, you can find yourself heading home each day with a sore back due to having to lift the person you care for into bed. There are a number of reasons that people choose to seek employment in the home health care industry. There will always be elderly people who need care. Know the difference between home health aides and home care aides. There are various types of positions within this industry. Most training is on-the-job training and is conducted by registered nurses or other medical practitioners. Some people are attracted by the chance to help others in a very direct, even intimate way. No worries. Also, the people for whom you care may not always be friendly or in a good mood. Two. These workers are under the management of a nurse or other medical professional, and they provide some limited health services. In fact, wherever there are people, home health care workers are and will continue to be in demand. Home health aides usually work for certified health agencies that receive government funding and therefore must comply with certain rules in order to continue to receive that funding. They are supervised by a social worker or other non-medical managers. If you are considering working in this field, here are 5 things you should know: 1. The positions are widely available in every city, town, and suburb around the country. Just complete the training and pass the competency test and you will be on your way. If you need a job and have considered working in this industry, make sure you understand the requirements, benefits and difficult parts of this line of work. Other health workers like the idea that you can get a well-paying job even without having a high school diploma. And some like the flexible work hours that the position entails. Know that this type of work is not for everyone. Working in this industry can be very physically and mentally demanding. It is a good thing that many people are interested in working in this industry.